Hello everyone, my name is Danny Patel and I'm the Director of Pharmacy at Encompass Health. Today we'll be discussing traveler's health. To start off, to give a little background, there are several illnesses that can be acquired from countries outside of the United States, and as pharmacists we need to educate our patients on the most current information related to current outbreaks, disease transmission, and pharmacological and non-pharmacological preventative treatments and methods. The primary resource we can refer to will be the CDC Yellow Book. In disease transmission, there are three main ways that we will go through, and we'll discuss the most common illnesses, and the first one being food and waterborne illnesses, then blood and bodily fluids, and finally insectivitis. So here are some examples of the most common diseases or illnesses that can be acquired from the different modes of transmission, such as traveler's diarrhea, hepatitis A being acquired through food and water, contaminated food and water. Then you can experience hepatitis B and meningitis through transmission through blood and bodily fluids. And finally, insect bites, you can acquire malaria, dengue infection, Zika virus, yellow fever, or Japanese encephalitis. Here's a interactive drag and drop. So what I would like you guys to do is match each illness with the correct mode of transmission. And moving forward, we'll be discussing the different food and waterborne diseases and what methods we can take to help prevent those infections. First being hepatitis A. Hepatitis A is most common in developing countries where water and sanitation supplies are inadequate or limited. However, hepatitis A is easily preventable with vaccination, and the incubation period or period of time where hepatitis A can be tested for and show positive it averages between 28 days, and infected patients can be asymptomatic. However, some symptoms that they may experience can be abdominal pain, malaria, which is feeling of discomfort, anorexia, and jaundice. Severe illness can last for up to 9 months. However, chronic infection does not occur. And since it is preventable with vaccination, be sure to look back at the immunizations chapter to look at vaccination scheduling and the approved age. Next, we have traveler's diarrhea, which is the most common travel-related illness despite global improvements in health and sanitation. The primary pathogens causing traveler's diarrhea is E. coli. However, the other pathogens can include Shigella, Campylobacter, and Salmonella. Traveler's diarrhea can be acutely classified into 4 categories: mild, moderate, severe, and persistent. Places of highest risk, and this goes with all food and waterborne illnesses, will include Mexico, Central and South America, most parts of Asia, Africa. Now, the main prevention that we have for traveler's diarrhea will be avoiding foods that have been sitting out or sitting out on a buffet. You want to drink from bottled water or boil water for about 1 minute and avoid having ice. If you have raw fruits or vegetables, only eat them if you can peel or wash them with clean water. Be sure to wash your hands with soap and water often, and carry hand sanitizer in case of there's no soap or water available. You want to be sure your hand sanitizer has or contains 60% or more alcohol. And avoid eating at local eateries. You want to eat at well-known restaurants, and that should decrease the risk of acquiring traveler's diarrhea. We have both non-pharmacological and pharmacological prophylactic medications. So we just discussed the non-pharmacological preventative methods. Now moving on to the pharmacological. The primary choice for antibiotic prophylaxis is rifaximin, with the secondary choice being bismuth subsalicylate, which is known as Pepto-Bismol or Capectate. Azithromycin will be preferred for breakthrough therapy.